Order, order. Welcome to this evidence session for the Home Affairs Select Committee looking into the Home Office response to COVID-19. And today we're looking particularly at the ongoing policing of the coronavirus regulations and legislation as part of the response to the pandemic. We're very pleased to have with us today ACC Owen Wetherill, Commander of Operation Tala from the National Police Chiefs Council, who leads on the response to coronavirus, Chief Constable Pam Kelly from Gwent Police, Chief Constable Andy Rhodes from the Lancashire Constabulary, and also Assistant Commissioner Louisa Rolfe, who's the NPCC response on domestic abuse as well. Welcome to all of you this morning. We're grateful for your time. Can I start, ACC Wetherill, with you, with your assessment of how things are going at the moment in terms of policing coronavirus?
So, good morning, Chair. The situation continues to unfold, obviously, from a viral perspective. That continues to present new challenges. And as we can all see at the moment, the viral infection is spreading, and that is particularly acute in some areas in the north and is spreading to other areas of the country. What that means in the policing context, of course, is that what we've got is a differentiated response in different areas at the moment. Some areas that has been ongoing for some period of time. So the northwest, for example, Greater Manchester and areas around that, and Lancashire, as Mr. Rhodes will cover as well, have been subject to much tighter restrictions for much longer. That has required a much greater policing focus than some other areas of the country. So quite naturally, you are into a much more sustained policing response in some areas than others. The other practical issue that comes with that, of course, is the nature of the regulations themselves, which are different in different areas of the country. And there are a continuous evolution of those regulations. And with each of those comes a requirement for new guidance for staff on the ground, for us to make sure that they are properly briefed and understand what those regulations are so that we can effectively engage with the public. So I would describe probably that the largest challenges for us at a national level are that differentiated piece across the country, and enabling our staff across the country to understand what that means, because it's not just about the regulations in their own area. They may be dealing with a situation which involves somebody from a different area where there might be tighter restrictions which apply to them in a slightly different way. So the best example of that currently, in a current context, which I'm sure Pam will talk about in a moment, is the difference now between Wales and England and the ability to travel across borders or not. And that's something we saw earlier in the pandemic as well, where there were differing regulations. So that means that officers on both sides of the border need to understand how that applies. It's not just about their own area. So the complexity of the regulations to enable officers to do their job effectively is a real issue for us. And with every evolution, that needs to be reset, revised, new guidance issued. And we find we are frequently doing that in a very time-sensitive environment. And we have, on numerous occasions, struggled to get that guidance out to officers on time when those new regulations take effect.
And what does that mean in practice when officers don't have the guidance in time?
Well, we can't expect our officers on the ground to operate within those regulations without the proper guidance. Clearly, those regulations are law. They are enacted at pace, and we need to be able to understand exactly what that means and what guidance is appropriate for our staff before we can ask them to go and execute those powers. So invariably, that means a delay in us being able to exercise those powers where that's appropriate. That doesn't, of course, stop us from engaging with the public and encouraging compliance, and that is our default position. We want to encourage greater compliance because we know that is what will ultimately assist in stemming the flow of the virus. But where we need to enforce, we need to understand what that means in a practical context for each officer in each given location.
So as a for example, when you had the new Tier 2 and Tier 3 regulations come in, how fast were you then able to get the guidance and the briefings in place?
So the Tier 2 and Tier 3 regulations was a better experience for us. We did get sight of early drafts of that before it became law. We were able to influence that and start to draw together what our guidance looked like. So that was issued within 24 hours or so of the regulations coming into place. But by contrast, if you look at the self-isolation regulations, that was a very different experience, quite complex area, and that needed quite a lot of work to be done with colleagues in government to get to a position where we could actually translate that into something that officers could operate with. And that took us nearly 3 weeks to get there. So two very different experiences there, driven from very different circumstances. But what I would say is, I mean, our experience of working with colleagues in the Home Office has been absolutely excellent. They have been with us every step of the way here, helping us to work through this. The challenge comes from the source of the regulations themselves and the ability to be involved in that early discussion around what they might look like, what would work well, how we could influence that to make it better, and also how it actually translates for the public, because let's not forget, this is about the public understanding it as well. And one of the constant bits of feedback I get from forces is there is confusion for the public because there are so many different variations of this. And if you take Greater Manchester as an example, they have had up to 5 different sets of regulations which are slightly nuanced in different areas of the force area. So the complexity of this cannot be understated.
And when you say the source of the regulations, by that do you mean the Health Department on number 10?
Well, ultimately it would be the Department for Health that would actually draw the regulations together because they're enacted under health legislation. So what we find is that they will draft the regulations, they will come then through to ourselves via the Home Office for us to consult on. But on a number of occasions now, we don't see the final draft at all until it's pretty much enacted. Where we do see it, we do have ability to influence that, and that is really welcome. And I would really encourage greater access to that at an early stage, because we want to help colleagues in government to get this in the best possible.
And Chief Constable Kelly, how have you found things going?
Good morning. So first of all, from a Welsh perspective, I have to say, in terms of consultation by Welsh Government with Welsh forces and with local authorities, it's been first class. In terms of that early consultation, dialogue, actually seeking views as to how we can manage pandemics in local areas. And that's been very much appreciated. But just to share Owen's point, the regulations landing have been late, and that has caused us problems in terms of getting messages out to our communities and, of course, the officers that actually apply those regulations. So the consultation, the dialogue has been first class, but again, it's just being responsive to those regulations has been difficult for policing. But I would like to say that I think we should be really proud of the policing response, because although at the very early stages of the pandemic, crime did take a downward trend, which was good in many ways. Now our crime levels are the same as they were before the pandemic. So we now have police officers dealing with high demand in terms of crime, going into the winter and trying, of course, to police these regulations as well. And Policing in Wales wants to be a part of that and absolutely wants to step up into that space. But I think an understanding of the demand that this places on policing is hugely important at this time.
Thank you. And in terms of the being able to police the new firebreak that Wales has in place, do you anticipate that being different in any significant way to the policing challenges you faced during the first national lockdown?
As it stands, it will be very similar to the initial lockdown that was undertaken nationally. We are still working with Welsh Government in terms of what any changes to enforcement would look like. But again, those conversations are taken 2 or 3 times a week. So we're very much in dialogue. It's very much a partnership approach, albeit we need those regulations to land sooner rather than later. But it is difficult to police, but it's also difficult because, of course, the situation has been fast changing, and policing appreciates that. The concern we have is that those regulations have to be in place in order for us to help in terms of policing. But of course, at this time, public expectation is high as well. So every time the regulations change, there is increased demand in our control rooms because people are ringing police in often to find out what those changes mean for them. So every time there is a change, there is an increase in demand. And of course, as Owen has suggested, we really need to refine decision making versus the application of needs to be done sooner, so that we're in a position to police in line with public expectation, and of course in line with what the public think is actually available in terms of regulations at that time.
Thank you.
Often we're playing catch up rather than implementing and policing at the same time that the regulations are enforced.
Thank you. Chief Constable Rhodes, can I ask you about how things are going in Lancashire?
Thank you, Chair. From the day one, like the vast majority of forces, the police chaired the Resilience Forum initial response phase and in full lockdown, notwithstanding what Owen and Pam have said, which was, we were dealing with things very late, very ambiguous early on in that pandemic. It was in some senses far simpler to police the full lockdown. The demand went down, as Pam says, for core sort of policing, acquisitive crime, less burglary, this type of stuff. And I think from the public's perspective, it was far easier to understand what you were allowed to do and what you weren't supposed to be doing. And when I look at, what's on the 4 E's, the type of enforcement we've done, if you take fixed penalty notices as an indication of how much enforcement was done, out of Lancashire's almost 900 tickets now, 600 were done in April and May. So in that period when it was very clear that you weren't supposed to leave your local area to travel somewhere else, that was, for COVID, it was quite, straightforward. We then saw that lift off, and we know the complications there of having either a full lockdown or a partial lockdown. And we saw some of the demand levels. It was almost like people were just so glad to get out, quite frankly. New Year's Eve level demand levels, particularly around alcohol-related issues, large gatherings, etc. That sort of tailed off. The infection rate dropped down, probably, as we know, not as low in the northwest. It didn't plateau down as low as in other areas. And we could see in the LRF, that is now chaired by the Chief Executive of Lancashire County Council, Angie Ridgewell, who's doing an amazing job in the recovery phase. We could see the numbers starting to come back up again. And so we changed our operational stance accordingly. And, as we enter into Tier 3, that, again, is far simpler for us because we're a pan-Lancashire service than having different district councils having different regulations. And so, I can understand why those local areas would want differences. But for us, for our staff who are moving across different areas of the county, and for the public, it's far easier to have one set of guidelines and regulations for the whole force area. What we're seeing now is the inevitable lag time is hitting, acute care beds this week for the first time. We've got more people COVID positive in acute care beds than not. So we know that the infection rate creates this rising tide of knock-on effects into hospitals. And that's where the LRF response is at the moment with partners.
And can I ask you, how many times have the regulations changed in Lancashire over the last 2 months?
That would be, I think the fact that I find that difficult to answer would answer your question somewhat, Chair, because, initially we had the whole lockdown, and then we had, I'd say 3 to 4 times altogether, we've had significant changes. The people who hold the pressure on this are the central team at Optala and MPOC, because what we learned very early on was that we would delay our operational response and our briefing to staff until that guidance had been cleared up. Because we got very good, straightforward, operationally usable guidance from TALA sent out to us, particularly around the Tier 2 to Tier 3 move. And I think we learned not to jump the gun and wait for that to come. And what we've done tactically here, and every force will have done this, is dedicate resource to the COVID response. So you've got less staff to very quickly update in terms of any changes to legislation, rather than the whole of my 6,000 workforce needing to know everything within the first 24 hours. I can make sure that I've got people with quite a bit of specialist knowledge now, actually, about what is and isn't okay, and the same in the contact centre. So over the period of the last 7 months, I would say, up to 5 times there's been significant changes.
And so, I mean, I was just looking, part of the reason I asked it is because I couldn't work it out when I tried to look up how many changes. It looked like it changed on the 1st of August. You had some local lockdowns, then on the 8th of August in Preston, then on the 26th of August, some other variations, some areas strengthening, some areas easing. On the 2nd of September, the same thing happened again. Some areas further lockdowns, others eased. Same again on the 22nd of September, further local lockdown measures, and then the 26th of September, all of Lancashire under local lockdown restrictions, and then Tier 2 on the 14th of October, and then Tier 3 on the 21st of October. If you were a neighbourhood police officer in the middle of Burnley, for example, how would you keep track of any of that and know how to respond if someone asks you what they're allowed to do or not?
Yeah, that has been one of the huge challenges for our staff on the front line. The thing that we focused on is that, albeit these changes do create a degree of confusion for a period of time for the public and our staff, what we've been very clear on is that our strategy, and this is set by Gold, is to use the enforcement element of what we do very carefully and proportionately. So if you look at the total number of calls I've had for COVID over the period of the pandemic, at some points it's hit nearly 20% of my demand, then it's settled to around 4%. But actually within that, what you'll see is a very clear profile of people, places and premises that are blatantly ignoring the rules that were set from day one. They're not people, these are not, where we're doing our enforcement isn't in areas where there's confusion created by differences. So for our staff, we've been very clear, focus your efforts on the stuff that is clearly illegal, because that's really important to maintaining public confidence for us. And, the people who are all doing the best, which is the vast majority, to try to unconfuse themselves and learn the rules themselves, they expect us to do something about the people who are blatantly ignoring them. And so that's for our staff. We have been, and I think we've got this balance really right, something to be proud of actually. And the feedback and the sentiment analysis from the public on this that we pick up is they understand we're in a very difficult area here. It's a wicked problem. And we wouldn't normally do a huge amount of enforcement in wicked problem areas. We do a partnership problem-solving response. So I do think that that's made it clearer for our staff. For example, with the £10,000 fines, we don't authorise those. We have an authorisation level with a senior officer before one of those is issued. And on occasion, we will take a day to have a look at the evidence of one of those cases before we make a decision to go back and issue a fine to an organiser of a large event. So we've tried to support our staff in that way and tried to tell them they don't have to be an expert on all this sort of stuff within the first 24 hours. They're living in Lancashire. They are can be as confused as other people.
So does that mean you've had a sort of reduction in the fixed penalty notice approach to the sort of people meeting indoors, outdoors, who might be actually struggling to keep up with the regulations?
The first 2 months were out of Lancashire has done what I think is a proportionate amount and a fair share of fixed penalty notices. We're up to around 900 at the moment since the start. As I said, 600 of those were done in April and May, right at the outset in full lockdown, and they were for things like travelling out of your area, really clear and obvious breaches. Since then, obviously, out of our 900, it's really settled down, but we have deliberately started to change our operational posture regarding enforcement as we've seen the infection rates rising, because we've got data now coming from the health protection teams, the directors of public health, and we know the places in Lancashire where we're seeing infection rates rising. So it's appropriate for us to start doing more. But on average, we will be doing about 4 or 5 tickets a day in Lancashire. An example of why it's important to have an enforcement element to this, I think, and it's legitimate, is that over the weekend, because we went into tier 3, it was almost like some people thought we'll have a last blast. And, you know, our COVID incidents went up 25%. And so we issued significantly more tickets over the weekend. You know, we have got people, 150 people, hiring a marquee to have a wake. That is never from day one been a confused area of confusion. That will attract £10,000 fine if we can find the organiser. I don't set the level of that fine. What I say is that there needs to be deterrent for people who are clearly and blatantly putting other people's lives at risk, in our view. So it's not back to the levels of the first 2 months, because it's more complicated now in terms of what you can and can't issue tickets for. It's not all just about not moving. You know, you've come from Manchester for a day out in Blackpool, you shouldn't have done, you've got a ticket. It's not as simple as that now. So more of the enforcement responsibilities fall into local authority.
And can I ask then, this might be a question for Owen Wetherill. I'm just still trying to be clear, what is guidance and what is part of the law? For a tier 2 area, our area is a tier 2 area, Wakefield district at the moment, can 2 individuals from different households meet indoors?
So I haven't got the regulations in front of me at the moment, Chair, so I can't give you a definitive answer on that. I will quite openly state there are so many different variations. I am not conversant with every set of regulations, and I'm not going to try to be, certainly not in this session. I can give you a definitive answer on that afterwards, but I don't have it in front of me at the moment.
Yeah. So, but then that partly actually sort of reflects, I think, the difficulties that everybody is under when actually there's so many difficult ones that you can't respond. Yeah. Sorry, Chief Constable Rhodes, did you want to respond to that?
I will have a bash with that, because I was discussing this with my daughter as we moved from tier 2 to 3. She has twins, and she was very interested to know how many of her friends could still come round to her house or not to mix as we moved from tier 2 to 3. The big one for me moving from tier 2 to 3 is your household, not mixing with others inside your household, not mixing in going out for a meal with people from another household. That is the difference from tier 2 to tier 3. But in Lancashire, we've still got the rule of 6 outside. So you could meet people not from your household outside, okay, you know, in a park or whatever. So, but that is different in some areas of Liverpool. It will be potentially different in some areas of Manchester, and we see South Yorkshire now coming into tier 3, don't we?
Okay, but this this may capture a part of our problem here, because I'm now even more confused, because for a tier 2 area, I'd understood that actually we couldn't meet with other households indoors, that we could outdoors as part of a rule of 6, but we couldn't, even in a tier 2, we weren't allowed to meet indoors with other households unless it's part of the exemptions, work, childcare and so on. And the government website is really clear. It says you must not meet socially with friends and family indoors in any setting unless you live with them or have formed a support bubble with them. This includes private homes and any other indoor venues such as pubs and restaurants. That's in tier 2. That's different from what you just said, Chief Constable Rhodes, and it's also different from what the NPCC regulations, that guidance says for Tier 2. The guidance for Tier 2, alert level high, the restrictions says, restrictions on gatherings, participation in gatherings, prohibiting gatherings of 2 or more people anywhere indoors and no more than 6 outdoors, either within the area or outside of it. So the police guidance says 2 people from different households can meet in a private house or in a pub, and the government's guidance says you must not. It doesn't say you should, even just say you should not, it says you must not. How do I reconcile those things if I'm in Tier 2?
So if I can perhaps come in there, Chair. One of the challenges throughout this last few months has been the difference between what is regulatory and you cannot do versus government guidance. And there have been many occasions where that line has been somewhat blurred by some of the public narrative that's been put out in the media. or sometimes from government itself, which has caused confusion. We had got to a position where the regulations were fairly clinically clear, and it was really clear what you could not do, and that's what the regulations confined themselves to. What we've seen with the tiering is a reintroduction of a mixture of both things that you cannot do under regulation and guidance. And the tiering relates to both. And unfortunately, what that has done is confused the messaging again, which is exactly the point you're making there. And whilst I understand why there was a desire to do that, to put a strong encouragement to people not to do things that were felt to be likely to increase viral spread, I think introducing them in the way that we have done has introduced greater confusion. And that's exactly the crux of the issue here for me, I think. You picked up on it, and I think we're all struggling with that.
So if you're a police officer in Castleford and you're asked whether or not two people can meet in a pub, then if you've been following the government's website or watching Look North, you'd think, actually, no, you can't. But if you've been following the NPCC guidance, you'd think that you can. That's pretty hard on police officers who've got to deal with this every single day.
Absolutely. And that's the reason why the guidance we push out, before it goes out, goes through a very stringent process. It will go through our lawyers, who will cross-check against the regulations. It will go through Home Office lawyers. We will then get a second check on it again. And only when we are entirely comfortable that our guidance aligns with the legislation, and that's the important thing that we have most focused on, will it go out. And we make it very clear in each of those briefings that we do not enforce guidance. That is not our role. We need to be aware of it, but we don't enforce guidance.
And other members will want to come in on this and other issues. Briefly, but before I hand over to Andrew Gwynn, can I just ask Assistant Commissioner Louisa Rolfe, could you just give us your assessment of how it's been for the police responding to domestic abuse, which is obviously something this committee has been really concerned about throughout the pandemic?
Thank you, Chair. Yes, so the NPCC with me have been collecting domestic abuse police incident data since March, and domestic abuse reported to the police since the start of lockdown in March has increased overall by 2%. Now, we do know that that is very different to the data collected by the numerous helplines and charities. We have been working very closely with those charities, with a number of smaller charities across the UK, and also partners and stakeholders in the Home Office, the Crown Prosecution Service, etc. And we've commissioned some work to understand why there's that disparity. But also, we've been working very hard to promote reporting of domestic abuse to police. We've been very clear with local and national campaigns that the police service will respond to incidents of domestic abuse, and we did through lockdown. Those campaigns have been quite successful in terms of we've noted that there has been a slight increase in reporting every time the national and local campaigns are run. We've been really clear that we will respond. We've promoted the 999 silent solution for victims who may not be able to speak on a call. And we've also noted that victims have preferred some online methods of reporting. So most forces have been exploring how they use online ways of communicating with victims. And many forces have actually proactively contacted victims that they know are living in higher risk relationships. And we found some success from that. Many forces as well have run proactive campaigns to drive up arrest rates for domestic abuse. During lockdown, there was some quite high-profile work by West Midlands Police and the Met at an early stage of lockdown. And with the CPS and the court service, we've prioritised those cases, and we've had lots of assurance about the prioritisation of those cases. We're continuing to work with the court service about the current delays due to the backlog of prosecutions. In terms of that disparity in data, with the support of the Home Office, we've commissioned some independent academic research. At least 3 academics, Dr. Catherine Hole, Professor Sandra Walklate and Professor Graham Farrell, are undertaking some independent studies into why the disparity of calls to police and calls to helplines. Some of the initial findings from that suggest that around 30% of those helpline calls at the beginning related to other professionals or third parties seeking advice and support about how to respond to domestic abuse during the pandemic. We've also had some very interesting findings about, the impact of lockdown and COVID, in that one of the positive aspects is that there was a reduction in abuse by ex-partners no longer living with victims, but we have seen, as expected, an increase in some abuse with perpetrators living with victims, and we've done an awful lot. So Forces have used some innovation. They've run webinars with victims. Some have been quite creative in distracting perpetrators with bail and curfew checks whilst we then contact victims to see how things are going. And we've also particularly looked, and I know that there was quite a lot of alarm at one of your briefings regarding the femicide census, so we've particularly looked at the rates of domestic homicide. And we've carried out a detailed study, which is now being further evaluated by the Open University, to reassure you, and every domestic homicide is clearly an awful event, but there has been no increase statistically on the period this year in comparison with the same period last year in terms of domestic homicide. But what we are finding is that work is providing us a rich source of learning in terms of how we improve our response and how we work with others to reduce the risk of domestic homicide.
Thank you. I think that gap between obviously the calls to helplines and some of the responses that we're hearing from other organisations and the responses to the police is a matter of serious concern to us. I think we may want to pursue it further in a separate follow-ups, inquiries and so on as well. But I'll turn now to Andrew Gwynn. Oh, and before I do, may I just also say in response to all of your responses, thank you to all of your officers for what I know has been a very difficult period and continue to be so, not just as the regulations continue to change, but also as you face these very different and unique challenges as well. Andrew Gwynn.
Thank you, Chair, and can I add my voice to the thanks that the police are doing in these very difficult times. Policing the lockdown hasn't been easy for any of you. I want to, if I can, just follow up on the Chair's questioning, because I am a little bit concerned that the National Police guidance seems to actually fall outside of the law, because I've got the legislation in front of me off the government's legislation website for Tier 3 measures that were passed by Parliament 2 weeks ago, and it does say participation in gatherings indoors and in private dwellings. No person may participate in a gathering in Tier 3 which A, consists of 2 or more people. And then there's a list of exemptions. The exemptions include, obviously, if you're in the same family or support bubble. So 2 people from different families cannot meet up in pubs in Tier 3 or in Tier 2. And I am really concerned if the police guidance actually falls outside of the law. I don't know who would be responsible for checking up on that, but I think the committee could do with a note to make sure that the police guidance actually does reflect the tier system that Parliament has voted on, because it sounds like it doesn't.
But I'm happy to take that away, and I will give you a very definitive answer on that fairly quickly. Can I just ask which document you're referring to as the comparator there, please?
Yes, so this is the statutory instrument number 1105, Public Health England, the Health Protection Coronavirus Local COVID Alert Level Very High England Regulations 2020.
Yeah, okay. I will take that back and ask our lawyers and the Home Office lawyers to look again at that. But as I said earlier, that will have been through both sets of lawyers before we put that guidance out. So I'm surprised if there is a difference, but I will get to the bottom of that for you.
I mean, it's hugely confusing, and coming from an area that's been in local lockdown for 12 weeks, in Tier 2 currently, about to tip into Tier 3, you know, I do share your pain, because the amount of correspondence that my office is dealing with people asking some pretty basic questions that don't have very basic or easy answers, hasn't been easy for all of us. And that really brings me on to the next point, and perhaps ACC Wetherill, you can answer this, because the Association of Police and Crime Commissioners has expressed to us concern about the growing level of COVID fatigue. And, you know, I speak as somebody who shares that COVID fatigue in areas that have been under restrictions for a long time. Do you recognise that as being a problem, not just for those areas, but in terms of compliance and policing?
So I think it's quite a complicated one to answer. So it would be inevitable, we're all humans at the end of the day, for there not to be some level of fatigue, whether that's the public, the staff that are trying to engage with the public, whether that's us, the local authority, or anybody else. I think that's natural, and we can expect that. Interestingly, though, when we look at the degrees of compliance, so last week I was talking to both DFT and BEIS and various stakeholders around both the travel networks and the retail networks in particular, to understand what levels of compliance they were seeing, to understand what more we could do to try and drive that compliance higher. In both environments, those sectors are reporting something like 90% compliance with regulations in a retail environment and in a travel environment. And if I take travel as an example, we are seeing that as an increasing trend in compliance. Now, I would put that down to a range of different things. There's been some really strong, consistent messaging across the travel networks. Take Transport for London in particular, put an awful lot of effort into this. Transport Police as well are supporting that. So where you can put a focused campaign in place with clear messaging, we are seeing greater understanding and greater compliance. Where there is the challenge is where that cannot be done or is not being done. So where there is confusion, there is a natural opportunity for people to become worn down, confused, and less likely to comply. Not always because they don't want to comply, because they don't know what to comply with. So I think that there is a really clear message there for me, which is where it is clear and can be reinforced through clear messaging, we see much, much greater compliance. Where we can't do that or it isn't happening, that's where we have the challenge. And I think that's the area that we need to focus on.
And on that challenge, what are you doing to ensure that you don't compromise the very important relationship of trust between the police and the public? What challenges does this pose to the need to be able to police with consent?
So I think there are two parts to that. If I take a very strategic point, first of all, which is what I'm doing at the centre is trying to engage government to encourage them to simplify the messaging. So myself, Martin Hewitt, went to visit the Prime Minister some weeks back, and that was one of our key messages, to seek an undertaking to make some of the messaging much simpler so the public could understand it and would find it easier to engage with and to comply. That is a message I continue to push, and certainly as far as the recent tiering regulations, I made strong representations there that we should look for simplified, consistent tiers that would be the same wherever they were applied. That's what I thought was going to happen 10 days ago. The reality now is already starting to drift, and as we are seeing with Tier 3, there are nuances creeping in. So at a national level, that's what we are trying to do, and we're engaging to push that. But of course, those policy decisions are not ours to make. We seek to influence and to inform, to help decision making, but we don't control the actual decision making, unfortunately.
And if I could come in there, if I may, I think it's really important for the record that the tier system does not apply in Wales. So I think it's really important for the record that where there have been local lockdown issues in Wales, we've tried to have a consistent approach in terms of what the public can and cannot do within those local lockdown areas. I think it's really important that national, in this context, does not mean Wales. And then just picking up on the fatigue issue, absolutely. I think our communities are struggling. And therefore, the clarity of message nationally and then with devolved governments needs to be clearer going into the winter more than ever. People are worried about their jobs and they are worried about mental health and well-being and the like. So the call for action has to be around clarity of message going into a tough winter. But when we talk about fatigue, let's make it clear that we're also talking about police officers who are out there 3 o'clock in the late nights in the winter actually applying these regulations. So clarity in terms of regulations going forward is a must for our public servants and of course for our communities. But I just wanted to make the point that the tier system does not apply in Wales. There is clearly confusion, but not in the same way. And certainly now moving into an all Wales lockdown, it's very clear in terms of what our communities can and cannot do. We're still working on what the regulations are, but and there will obviously be elements of confusion, but it's not within that tiered system. It's important that that's recognised for the Home Affairs Select Committee.
Thank you. And then if I can turn to Chief Constable Rhodes, areas of Lancashire have been under specific local lockdown regulations, as the chair has mentioned, and very similar to my own part of Greater Manchester, these were translated across into Tier 2. Do you think, though, that the introduction of local measures when they were subsequently amended and then Tier 2 to Tier 3 has ensured that your officers are confident and that they know the rules? Because, you know, what we've heard already today is that there's a lot of complexity and misunderstanding, not just with the public, but also perhaps with the law enforcers.
Yeah, I mean, the way I look at this is that when you start to see the figures, the data rising in terms of infection rates in different areas of Lancashire, which is, you know, picked up through the weekly bulletin with the LRF analyst, you can start to see differences in terms of acceleration rate of areas, and you can see what's coming effectively in terms of, we sort of saw Preston coming, do you know what I mean, in terms of that was obviously going to go earlier into a more severe version of the lockdown. And that period that the chair cited, which was about over the period of 5 or 6 weeks, there was 4 or 5 different changes, was a very confusing period, because what's happened is that, you know, and it's understandable, the sort of structure that we've got around local government in Lancashire, 12 districts, 2 unitaries and a county council, there are many different opinions about what is appropriate, what's needed, the impact on their communities. And it's not really cut out, that structure, for a crisis situation that endures as long as this. I'm not sure what structure is actually, but, you know, there is a great deal of consensus in that system, and that doesn't lead to decisions being made quickly. And so before some of those changes in guidance were actually put in place, a new version came out, or a new district area, a new area of Lancashire started to move into a different level of restriction. So that period in time, I think, has been the peak of the confusion, I have to say. I understand that. The Tier 3 move, for us, is far clearer. Just going back to what Owen said, the less that we're asked to consider guidance around doing the right thing, we shouldn't really be policing that. We aren't policing that. We're not fining people for, you know, being confused around whether they can have 2 people in the house or not. We really are focused on the clear breaches, as I've said before. So the Tier 3 is better for us, but I understand the tension in the system for people not all wanting to go in together, if you see what I mean, because they've got their own local context, haven't they, in terms of some of the huge impact on the economy and communities in those areas.
Absolutely, and I share your pain. I have a cross-borough constituency, and for a period of time, one borough was under local restrictions and the other borough wasn't, and then they were both put under local restrictions, so it's been incredibly confusing. What are your relationships like with neighbouring forces? Because obviously the Merseyside force and now the Greater Manchester force will be at least on a consistent Tier 3 with Lancashire, but there is obviously this mix now of the law, the regulations and government advice, and not travelling outside of local areas is government advice. Yeah. How are you going to approach that, given that there is a lot of flow across the boundaries between Merseyside, Greater Manchester and Lancashire?
Yeah, that is one of the key things that I think you will find people, the vast majority of people, I think, will abide by that guidance. Don't travel out of your county area. But we will get people who decide to not do that. If you look at Liverpool have closed the gyms and leisure centres, for example, we fully expect that some people may travel into Lancashire, Cheshire, other areas in order to access those facilities if they're really upset that they can't get them locally, which people will be, won't they? So we will get, as we did in the early days, actually, you know, when we got a lot of people coming to Blackpool for a drink, because that area wasn't in as severe a lockdown as the rest of Lancashire. We will see people moving. So we focus on less about that if they're not doing the right thing and travelling, rather than what they do when they get there. So we're really interested in, are they going to a large gathering? Are they having an unlicensed music event? Are they going to a pub or a hotel? that's deliberately advertised to have an indoor rave or something, which we had at the weekend, despite numerous visits by us and the local authorities. So we talk to our neighbouring forces, but we are acutely aware of the fact that there will be the law of unintended consequences if some things are slightly different between areas in the region. You know, and we talk every week, chief constables in the Northwest, we have a dial in. Cumbria, you know, you saw Cumbria very much like Devon and Cornwall, North Yorkshire, really getting hit hard in the early days of COVID by huge numbers of people who couldn't go to Magaluf for the holidays, deciding to go and do that in Ambleside. And the whole nature of the policing of that area had to change for a period of time. So we do talk to each other to try and get ahead of the curve.
Thank you. And can I just ask Chief Constable Pam Kelly to come in on that as well, because obviously the travel restrictions into and out of Wales from England are enforceable by law, aren't they?
Yes, from hotspot areas in England into Wales, and of course hotspot areas in Wales into other hotspot areas in Wales. So that is very clear. And during the early stages of the pandemic, obviously Wales is made up of 4 forces, have an awful lot of people coming in for their holidays, North Wales and the Dyfed Powys area. And during the early stages of the pandemic, that was a real issue. And when you look at the fixed penalty notices provided by those 2 forces, about 60% and 70% of those fixed penalties were issued to people residing outside of the force because of the concerns of the transmission of the virus, especially because those were communities that at that time were very low in terms of positive results for COVID. A little bit different in South Wales and Gwent Police, much more urban and higher numbers of population, and not so many people travelling into those areas, but the virus was being spread very much around into households. So you definitely see a difference in terms of enforcement and how we in Wales are enforcing where the virus is being spread at this moment, at that moment, and now, of course, in this moment. But I think it is worth raising because obviously enforcement is absolutely being discussed and how we enforce as we go into tougher times. But I think it is worth mentioning that the fixed penalty notices during the initial lockdown, only 50% of them have actually been paid. And during the more recent local lockdowns, only 35% of them have been paid. And when we talk about backlogs for the criminal justice system, yes, they are improving in terms of magistrates' courts. There's still an awful lot to do in terms of Crown courts, albeit there's been improvement, but there's a heck of a lot more to do, especially linked to multi-handed cases, more than one offender. But I think we really need to watch this because in terms of enforcement, it's not just about fixed penalty notices. There are other ways that we can work jointly with local authorities and the like to prevent people from actually needing to be fined. So the prevention work is really important, as well as, of course, that element of enforcement, which quite rightly we need to look at. But we do need to keep an eye on the payment of these fines and, of course, the backlog that it is creating in terms of magistrates' courts and the Crown Prosecution Service.
Thank you. And before I finish, Chair, can I just also confirm that the wording on gatherings is identical in the statutory instrument 1104, which relates to COVID-19 alert level high regulations as well?
I think you're right, Andrew, and I think not only that, I think actually my description of the guidance was inaccurate earlier on, which just so shows quite how easy it is to be completely confused on what all of these mean. And so it also suggests that I think actually, in fact, to ACC Wetherell, it may be that the restrictions in the policing guidance do reflect the legislation as well, but it would be helpful to have clarity on that, seeing as it's proving our previous discussion suggests how hard it is for all of us to follow.
Yeah, we will confirm.
Thank you. Adam Holloway. Adam, I think you may still be on mute. Okay, I move to Diana Johnson.
Thank you very much, Yvette. I'd like to just move on now to look at some of the wider issues that we've been touching on already, but around enforcement. And I think it's been very interesting to hear what everybody's been saying about the need for clarity, so the public and the police understand exactly what individuals and businesses should or shouldn't be doing. So in all iterations of COVID-19 policing guidance have continued to emphasise the 4 E's, the engage, explain, encourage and enforce. So what evidence do you have that this approach has been the correct one to stick through the pandemic? And as we move now into the winter, and I think certainly the public are confused, as we've been hearing this morning, do you think that we are going to have to move the emphasis onto enforcement? And could you also say something a little bit more about what that will mean in terms of the fines that are not being paid for the fixed penalty notices? Is enforcement really going to actually mean anything to individuals who receive those notices? So my questions really is, are we going to move on from the strategy we've had so far? So I don't know, perhaps Owen, if you'd like to start on that.
Thank you. Yeah, so I mean, if I perhaps just contextualise the payment of tickets for a start. Pam mentioned there, in the early stages, the tickets issued at an early stage, we've seen 50% payment rates. I cross-checked this yesterday to understand how that differs or not from the normal issue of fixed penalties for other types of offences outside COVID. 50% is up the norm, is my understanding, so that's broadly comparable. I think where it is different is where you get a differentiation possibly between those that contest the case, which is very, very small as a percentage, versus those who simply do nothing, don't pay it, and we then go down the court route. That's probably the area where there is a bit of a difference. It's an early finding. It's something we're looking very closely at because we want to understand if this is driving different behaviours. There is some suggestion it may be, and that would be some indication straight away that enforcement alone doesn't get you the compliance that you want. What we are seeing in the reverse, as I talked about earlier, that reference data we've got from the retail sector and from the transport sector in particular, is where there is clear messaging, where there is engagement, where we are encouraging people to do the right thing. Essentially, we're getting the right response and people are then becoming more compliant. They are engaging with us. So I could give you a quick reference point here. So the British Transport Police have done some good analysis for us. So I know that they've engaged with at least 56,000 people around the wearing of face masks on public transport. Yet the number of tickets they've had to issue is only about 92. So there's a significant indication there that actually what you're getting when you engage is a degree of compliance and understanding. And if you're asking for evidence that the 4E's approach works, I would suggest that's a very strong indication that it does, because they are not needing to resort to enforcement on a significant basis. They are getting the degree of compliance that we want, and we are now seeing that as well through the analysis they've done of how many people are actually wearing face masks on a routine basis going through the travel network. So there's some clear indications there. Similar things have happened in the retail network where, on the basis of earlier changes and more emphasis onto the retailers themselves to do more to encourage people to wear face coverings, greater compliance has been driven largely through greater interaction, messaging, tannoy messaging in stores, that nudge principle to encourage people to do the right thing. That is what's driving the compliance. It's not enforcement. So I think you've got two very good but quite different indications there that approach of encouraging people after you've engaged with them is the right approach, which gets you the outcome you want. Because issuing a ticket doesn't guarantee somebody's going to comply.
Okay. Would anyone else like to say anything on that?
Hello. I think it's really interesting actually, because to put some extra context into it, Lancashire Constabulary takes 1.2 million phone calls a year. So we talk about 3,000 calls a day for service. And even at the peak in April and May of calls specific to COVID, we were hitting about 6,000 to 7,000 a month in those 2 months. So a couple of hundred a day. And that dropped right down throughout the summer period. So the calls will generate our activity, our deployment. The vast majority of those calls we deal with on the telephone because they are people who are saying, is it okay to do this? Or I've seen that my neighbour's doing something, having a barbecue in the garden. I don't think they should be. And so business as usual is a far bigger proportion of what we are doing than COVID. You know, we've got, I think that's one of the things that we should put into the mix around this conversation around enforcement, to put it into context. We are still doing the things that policing does, dealing with protests, dealing with murders, dealing with domestic abuse, as Louisa said. So that is 96% of my demand at the moment. 4% of it is COVID calls. And out of that 4%, I'm not deploying to a huge amount of them. I'm only deploying to the ones where I've got 150 people in a marquee, a licensed premises with 80 people in. We are generally not knocking on people's doors and saying, how many people have you got round for supper tonight? That is not the policing style of British policing. I think, just to echo what Owen said, and I know Pam will back me up on this, one of the things that we have to our benefit, and has probably got us through this, is neighbourhood policing. You know, the engagement levels that we've got in community have been built up over decades, and they are from time to time put under pressure. But, you know, we've got 1 million people signed up to our social media channels in Lancashire. And that level of engagement is going on in the background all the time about normal policing issues. COVID has become like another version of antisocial behaviour for us. That's what people are ringing us about. Some of the COVID calls we're getting are actually normal antisocial behaviour calls. There's 20 kids in a park and they shouldn't be there because of the COVID regulations. Do you see what I mean? So we were putting the same policing response into those things that we've always done to some degree. And I do think the fixed penalty notices, you know, I think we're up to 20,000 nationally now that we've done in total for 7 months for, you know, a country as big as this. It's 5% of actually the COVID calls I've got attract a ticket. So I do think on the 4 E's, 95% are on the 3 and 1's on the 4th E, and we will continue to really closely monitor that because it is a very difficult area for us to police, as you were saying on the committee.
And if I could come in there, if I may, just to support Andy, but also in terms of your question around 4 E's and whether that remains relevant. Police legitimacy, the legitimacy of policing and public confidence is really important for us. We need to keep our communities working with this. And going back to clarity of message, it's people's behaviour that needs to change. We need to really educate people constantly throughout this crisis in terms of the need for behavioural change. It does concern me that as we go into the next phase of COVID, that there is this obsession with fixed penalty tickets. It has its place, but actually during the height of the summer, when we were stopping vehicles, Gwent Police alone took 280 vehicles off the road. Now, we could have easily given them fixed penalties for COVID, but actually, whilst we were explaining and engaging with people, we saw that there were people driving without insurance, involved in other criminality. And actually, I wanted to go to the stronger message rather than giving them a fixed penalty notice. And I think so we need to think much more broadly around what enforcement looks like. It's not all about fixed penalty notices. And at the moment, I think your question is very relevant in terms of the 4 E's. So now that we've had COVID with us for over 6 months, clearly the educating side of things, people should know that there are guidance and law that they should be sticking to. So when people are blatantly flouting the law, we do move to enforcement that little bit quicker. But because of some of the confusion, it's very difficult to deviate away from those 4 E's and go straight to enforcement because people are confused in communities. So the 4 E's does stand firm for us because our legitimacy, our public confidence and trust in policing is more important now than ever before. And the 4 E's helps us hold on to that with our engagement with our communities.
Thank you very much. I just want to ask one further question, which is about the resources that you have, the human resources. And in terms of right at the beginning of the pandemic, I know there was concern that you might lose lots of your officers and backroom staff to COVID. And I know in my own in Humberside police force that wasn't the case. The numbers were low, and I think that's generally been the case. But I just wondered, as we move into the winter, and we know all the other pressures on the winter when people get flu and all the other problems associated with the cold and dark winter months, what thought's been given to whether mutual aid might be required in certain areas? And also, I wondered if you could say something about the role of special constables. I went out in the centre of Hull on July the 4th when the hospitality sector reopened, and the special constables were really providing the backbone of the nighttime economy policing, and really important. And I just wondered whether you saw the development of the role for special constables. So those are my two bits to the question.
So I'll take the first question, and then I'll perhaps let Andy and Pam talk about specials, because that's more part of their bailiwick. In terms of the resourcing levels then, so you're right, we did have a concern about that from the outset. We deliberately put in place some very clear national monitoring around absence levels, and that's not just at a top level. We drill down into resource type as well, so we can have confidence around, can we keep our arms capability afloat, our level 2 public order capability, our general patrol capability, call handlers, custody staff. So we understand it in quite granular detail at a national level and at a force level. We tracked that in the early stages daily because we were concerned. It didn't get to the stages of absence that we thought it might, which was a really positive, and we saw some really, really strong indications that staff were doing all they could to stay at work because they recognised the part they needed to play in the national response. So there's a real sense of sort of collective pride in making sure we stayed afloat there. As things have moved into the summer, we saw that the absence levels that did creep up drop away notably, and they've largely remained there since. We've seen a small increase recently, but nothing that is of concern at this stage. We continue to monitor it regularly. That is an embedded process now, which works really well, and all forces are joined up to. So we can understand that picture in a very, very good detail. In terms of mutual aid, I mean, that's a core part of what my department does in normal daytime business anyway. So we're very well versed around how we need to look long term as well as short term to understand what the demands might be. You're quite right to identify that the winter presents some unique challenges. It does every year for concurrency. This year more so than most because of the still remaining COVID challenges. We've got the EU exit coming too, as well as some of the pre-planned dynamic events that we need to respond to. So that is a core part of day-to-day thinking for me and my team at a national level. At this stage, I am entirely comfortable that we've got really good, robust processes in place. Our workforce is in a good place in terms of absence levels, and we can respond where we need to, but we're not complacent. And one of the things that I've started turning my mind to more recently is how do we make sure that against the rising tide of COVID infections remains the case? How can we, where appropriate, if possible, access greater testing if that becomes necessary? At the moment, that's not a great concern, but Andy can talk about testing for us if you want to. He leads on that nationally, as well as if and when a vaccine becomes available, is there a point at which it becomes right and appropriate that we have some access to that for specialist functions to make sure that mutual aid you're describing there can be facilitated and can be delivered? So we're not at that point, but we're having the right conversations to make sure that we're across all those issues.
I just want to try and bring Adam Holloway back in, so I'll come back to you, Chief Constable Rhodes, shortly on that if you want to add anything further. Adam, do we think you've got your mic working yet? I mean, people in the room are shaking their heads at me, so real apologies to Adam Holloway. We're having technical difficulties. I'll go to Diane Abbott.
Oh, Yvette, could I just hear what Andy
sorry,
was
yes.
going to say?
Sorry,
thank you.
Andy, do you want to just give us a sort of brief follow-up on the testing thing, and then I'll go to Diane Abbott?
Yeah, just quickly on the testing. As Owen said, this, it's part of the sort of overall plan for us to maintain business continuity, having access to good testing. And we've done that. Most forces have done okay with that at Pillar 1 and Pillar 2 sites around the country without too much trouble. But we have got contingency plans if that comes under pressure, because in lockdown areas it has come under pressure and we need to get access to that testing. But I do think, in my force of 6,000 people, we are testing about 350 people a month. And at any one time, we've got about 150 to 200 isolated. They're not all symptomatic, so they do still contribute. If they're asymptomatic and they're well, they can work from home and still contribute. And that's been remarkably consistent. But what we've got data dashboards that show us which roles they're in, age profiles. We've done extra work about black and ethnic minority officers, because we know there's a higher risk that's come out of some of the work from Public Health England. So we put extra risk assessments in those areas as well. And I think we've kept the confidence of the staff up, because the PPE supply has been very good from day one, because of the work that TAL has done. And the Police Federation surveys back that up. Just quickly on specials, as you say, that for people who have a day job on top of coming in and doing a really difficult policing job, they have provided the backbone of the work for us around licensing visits, for example. Over 200 licensing visits in one of my divisions was done by the Special Constabulary a couple of weekends ago. Preventative visits to explain and say to people what you should and shouldn't be doing in licensed premises. So they've really stood up. As our volunteers, actually, we've seen a massive increase in people volunteering through the volunteer partnership in Lancashire. People who are furloughed, maybe haven't been able to work, or they've got issues with work, have really stepped up, and that's been one of the positives, I think, out of an otherwise really difficult period.
Thank you. Diane Abbott.
Thank you very much, Chair. I wanted to ask about the possible role for the Army. In September, the Prime Minister said that the Army could provide support for the police. What sort of support would that be? How would it work? Owen Weatherall?
Thank you. Yeah, and this is a question I know the Chair raised the last time we met back in March. So we've been clear from the outset that we don't see a need for military to support us in a law enforcement role. That remains the case. We are more than comfortable. We have the capability to do that ourselves. Where we would look to them, and I can give you an example around this, is for very niche capability, specialist knowledge that they have. So when we set up the National PPE Hub, we called on the military, the Royal Logistics Corps there, to help us with the setting up of that process. And they lent some staff to us for about a month to help us get that process up and running. And that was a very deliberate niche use of their skill to give us the knowledge we need to get that up and running. And that was a fundamental part of making sure that process worked really well, and it does work exceptionally well for us, partly because of their work and partly because of the decisions we made around that. So that's the sort of use that we would look to use them for. I know there have been more recent discussions and reference to that from the PM around how the military might be employed, and certainly from a law enforcement perspective, that's not something we need or are seeking. Where I think they can provide some value, and I know that some forces would be familiar with this, is perhaps in the support role to local authorities. And I think perhaps Andy can make a comment here, because I think you may have had some conversations in the Northwest around this.
Yeah, as Owen says, they're clearly not on the enforcement and the visible side of the collective effort. But from day one, and this is the same for other crises we've had, such as flooding, I always welcome seeing military staff landing at headquarters into our coordination centre, because they are professional. Their expertise around logistics and planning, particularly, as Owen said, is second to none. And my Deputy Chief Constable, who initially chaired the initial response phase, had a lot of military support in there. The humanitarian side of it was a logistical issue, which they, again, contributed to. So that's the real role moving forward for us. And I don't think there's any sort of contention around their role from their perspective or ours. It's very much with us behind the scenes supporting the logistical effort.
So you don't see a role for the Army in enforcement?
Most definitely not, no. And I don't think they would be seeking that or want that either. It's not something that they would. That's not what they're best suited and tasked to do in our view and theirs.
And have policing bodies had any conversations with the Home Office about the nature of the support they provide?
So we have had a number of conversations at different points around whether or not there's a particular use for the military. We've explored one or two niche capabilities. There's another couple that are being discussed at the moment, but as I say, they are niche capabilities. They are not law enforcement roles. And as Andy says there, I mean, that's very much the military's view too. That's where they see themselves.
Thank you for that. And can I ask, at the weekend, it was reported that the police could receive data from NHS Track and Trace in order to follow up people that were not complying with self-isolation. Isn't the problem with this that if people think that if they get tested and they're asked to self-isolate, the police may come knocking? Isn't the danger that they just won't get tested?
So I think if I perhaps unpack some of this, because there's been some mixed messaging around this, and I'm not sure it's helped the conversation at times. So this came about through the decision to make the requirement to self-isolate a requirement that could be enforced. That was something that then came to us as a question of how would we do that. Clearly, if we are going to follow up on any of these, we need to have access to some information to enable us to understand whether or not somebody should or should not be self-isolating. So that took us into conversations with Department for Health, which is one of the reasons why, as I mentioned earlier, it took us nearly 3 weeks to get to a point where we could give guidance, because we needed to have clarity on what information might be made available to us and how that would work, so that we could actually come up with an agreement with Department for Health around how that would work. I stress this is not access to the track and trace app data at all. And the information would only be on a case-by-case specific basis. So we're not talking about bulk data here. So the sorts of scenarios you could envisage are one of two things. Either something is reported to policing where there is a concern about an individual who that person reporting it believes should be self-isolating. Clearly, for us to make a decision about whether or not we should take any action, we need to understand whether that's the case or not. So we would make a specific inquiry about that individual to Department for Health to verify whether or not they should or should not be self-isolating. And they would provide only that information around that individual. Similarly, as part of the assurance phone calls that Department for Health will undertake around this again, if they raise a concern, potentially they might want to do that. The existing method at MOU that's been put into place only concerns the first of those instances where something's reported directly to the police. We have not yet got to the point where we have addressed the issues around referrals from Department of Health to us directly. So this is purely about calls to the police where we need to verify if somebody is or is not required to self-isolate.
I've seen guidance which suggests that once the police are informed by Test and Trace that someone of interest should be self-isolating, the police should risk assess whether or not to visit the individual. What would the risk assessment involve?
So that would depend on the information that's been made available to us ultimately. So, I mean, like any inquiry that's to do with COVID enforcement, we will look at each case on its own individual merits. And as part of any deployment of an officer, we would always do a risk assessment anyway, just to understand what we know about the individual, what we know about the environment where they are. That helps us make decisions about something as simple as, do we send a single officer on their own, a PCSO or a double crewed car? So it's a practical assessment we go through all the time when we send an officer to a particular incident.
And some data experts have said that sharing data with the police, Test and Trace sharing data with the police, could reduce trust between the police and the public and the government. Have you assessed this?
So, and that is one of the key things that we talked about with Department of Health. That's one of the reasons why we took very deliberate steps, again, taking legal advice to make sure we did it properly if we were going to do it, and to make sure that only the most appropriate data to that particular case is shared. It's something we're acutely aware of whenever we get into data sharing arrangements. But clearly, if there is a requirement, which there is in this case, for us to have a role in this process now, and to do it with a view that some of this may result in enforcement at the hard end and the issue of a ticket, we can only do that if we have access to the information. So it's one of those situations that's driven by the regulations. There's a requirement on us to do this. If we're going to do it, we need to make sure we can do it on an evidence basis where that's appropriate and we have the information that we need.
Thank you very much. Thank you very much, Chair.
Thank you. I'm just see if Adam Holloway we've yet resolved the mic issues. really sorry for Adam for this. We'll go to Tim Lawson.
Can you hear me now?
Oh, yes, yes.
Hooray.
We can hear you.
Miracle. Thank you very much. A couple of questions for me. I can see that there's a lot of scope for confusion with rules changing and everything, but do the panel think that that is preferable to the sort of one-size-fits-all, irrespective of local circumstances that we had at the very beginning? That's the first question. And the second one, you've alluded to 150 people at a sort of rave. Could you give just some colour, a bit of a description for the committee of the sort of things that you've come across that have startled or surprised you?
Well, on the one size fits all, my sort of professional view of this is that in the early days of COVID, we didn't have the benefit of the data that you need. You won't do, because, if you're not doing enough testing, you're not going to get enough data. And the data should drive the different levels of interventions that are put in place. That's all I will say. So if the data is telling you that there is a serious problem in one place more than another, then I think it's an intelligence-led approach to trying to deal with what is an incredibly challenging crisis, isn't it? So I always try to go back to data if I'm making sense, and because you've got some evidence there rather than opinion around actually what's happening on the ground. So it's not for us to say whether or not a one-size-fits-all is better. Policing is always easier the simpler it's presented to us, but we appreciate that there are competing issues and agendas around trying to deal with this pandemic. Just on the sort of things that surprise you, I think that's a really good question, actually, because one of the things I think, and leading back to Owen's point about how involved policing has been in this pandemic from day one, I think one of the things that we can bring to the table is that very little surprises us, quite frankly. I look at the logs every day, and I've spent 30 years policing, and not much surprises me anymore. And we can anticipate, actually, the sort of behaviours that are going to happen as a result of different things being done, particularly around restrictions, etc. So we've had, 150 people in a marquee for a wake. When our officers get to that at 11 o'clock at night, there are literally 4 or 5 officers. The safest thing to do is to allow that to continue and deal with it in the morning. Because if it's an infection risk, which it is, what we do not want to do is distribute those people around licensed premises in the town nearby, or have our officers having to make significant numbers of arrests. So we deal with it very proportionately. And we have seen, and I've seen another job from a log from a premises that is persistently ignoring the rules and continuing to try to hold unlicensed events of large numbers of people in its premises. And, that for the good pubs and restaurants that are doing the best and spending lots of money on infection control and making sure contact tracing is done properly, they need to see those premises being addressed. And so it's no surprise to us, actually, some of the things that have happened. It is the usual suspects that on a normal quiet day don't do the right things for the rest of the people in their communities. That's not come as a huge shock to us.
Chief Constable Kelly.
Thank you very much.
And if I may come in there as well, the one-size-fits-all issue, yes, very much discussions between local government and Welsh Government in terms of the data. And of course, proportionality was always the word that was used until, of course, the virus increased significantly. But in terms of being surprised, I think constantly people meeting in each other's homes, people who are generally law-abiding, all of a sudden feeling that, considering that it's okay for, 10, 12 people to meet on a weekend in their homes. And so the public understanding and people actually thinking that they're immune to this virus has been quite shocking in terms of the demand that has placed on policing and, of course, the extent of the spread of the virus. So clarity of message is important. But also in terms of surprise, not surprised because, like Andy, I've been in policing a long time. But I do think the way that we talk about policing as key leaders, as key politicians, we really need to talk about, we're not talking about great numbers of people who are dealing with domestic abuse, road traffic incidents, violence on our streets. Obviously, during this time, we've seen a significant number of protests, and some of our policing numbers have been significantly reduced over recent years. We have Operation Uplift at the moment, but I really think we need to understand that it is the same police officers out there dealing with COVID as are dealing with all of those other incidents that are happening at the same time. And I think we really need to, in our language and in the way that we talk about policing, really value that local bobby that's out there dealing with all of these things, including COVID, during this difficult time. And whilst police officers dealing with domestic abuse, dealing with assaults are. And I think that really needs to be valued at this time.
Thank you.
Thank you. Thank you. Tim Lawton.
Can I come back to the subject of fixed penalty notices? Chief Constable Kelly, you described them just now. You said it's not all about fixed penalty notices, and we've had the figure of about 20,000, I think, issued so far, which, as Chief Constable Rhodes has said, it represents about only 5% of the calls that he's dealt with. The trouble is, public perception is that abuses are not necessarily being taken seriously. You have a group of people who don't believe in COVID, or they don't agree with the restrictions, and will actively go out and abuse the regulations. Then you've got a set of people who may abuse regulations by mistake, not least through some of the confusion. But then in between, you've got a group of people who say, well, they seem to be letting loads of people into Lidl without wearing masks, or they're always having parties around at that house, so why should I actually comply as well? And given that there have been no successful prosecutions under the provisions of the Coronavirus Act, and we've had a few prospective £10,000 fines, which I think are much more easy to apply and to recognise, what real sanction is there for people to see that if they do consistently not abide by the regulations, there is a sanction and a penalty? Because most people think, oh, well, we're going to get away with it because everybody else is. Isn't that the problem, Chief Constable Kelly?
I think you're absolutely right in terms of what levels of enforcement are available. So we've mentioned the £10,000 fine, which was used for raves and the like during the summer season and large gatherings. Other than that, of course, it's the joint enforcement approach with local authorities. And so in terms of visits to licensed premises, supermarkets and the like, many improvement notices, as in hundreds, have been served on premises, improvement notices, in order for them to improve in terms of some of the COVID issues. And many licensed premises across the UK have actually been closed at this time because they have been breaching the regulations and the law in terms of how they've managed their business. So that's what I'm trying to say in terms of one size doesn't fit all in terms of fixed penalty notices, because there are an array of other legislative matters available to us with our partners. And enforcement for me needs to be a joint enforcement approach. And as you've explained, and I think this is a conversation that we now need to have, is that once hopefully there are clearer messages and our communities are very clear moving into the winter in terms of what the law is, we do need to consider what our fixed penalty fines ought to be. And if they're not deterring people, then potentially we do need to look at increasing those fines. But going back to one of my earlier points, for me, this is about making sure that people's behaviour is recognised as the issue, and not just putting tickets everywhere and us becoming the COVID police. For me, those people that clearly flout the law at this moment in time we should be moving to enforcement quicker. And we are seeing the forces across the country are actually doing that.
Okay, perhaps to come on to AC Weatherall here. Chief Constable Kelly just mentioned a number of premises closed down, licensed premises. Do we have a figure for the number of licensed premises? Because again, a complaint that comes to me, and I'm sure other constituency MPs, is that there are pubs that are, still packing them in. There's no sign of social distance. They're still going to the bar if they're supposed to be table service. These sorts of things. And again, that presumably is happening because the publicans think, well, we can get away with it because it's not being enforced. If, however, we've got clear figures that many hundreds of establishments have been closed down in particular areas or whatever, then they might take more steps to comply with the regulations. So why don't we have more information about that? And where AC Weatherall, do you think most abuse is actually happening? Is it in households? Is it in hospitality? Is it in organised events? Where?
So if I deal with the first question around licensed premises, and part of the reason we don't have that clear picture is because a lot of this doesn't rest with us, it sits with local authorities and their licensing departments. So what you are seeing up and down the country is a mixture of approaches. So clearly those cases that get reported to us or we fall across in the course of our normal duties or are reported to us, we will commence some activity around that. We are doing a lot of joint licensing visits with local authorities up and down the country. So if I take Manchester as an example, I know they've done over 500 joint licensing visits through the course of 1 or 2 weekends just to try and make sure that there's a very visible presence to try and encourage compliance and to deal with those where that isn't the case. Now that is a similar approach that takes place across the country, but the reason we don't have clear data is because it doesn't rest just with policing. There is a local authority element to this, and obviously collecting data across different agencies, different entities, and lots of different boundaries isn't always the easiest challenge to address. So what I can say with absolute confidence is there is a very concerted effort to focus on licensing across the country. There's a lot of effort going into it. What we do see from that is largely compliance. We've all seen the headlines of where that's not the case and some of the graphic images, but the reality seems to be that that is the exception. And the vast majority do comply, and where they don't, we work through that step-by-step approach with them, or the local authority does. And that may be something that one of the chiefs wants to comment on in their own area. I know that Andy's had some challenges with licensing in Lancashire. But in terms of the wider question, in terms of where do I think the vast majority of the breaches are, I would say early stages, certainly through the summer, we saw an awful lot in the emergence of large events, gatherings, music events, and that was becoming a problem across the country, across all forces to varying degrees, some quite notable in their size. That is one area where that much increased fine size had a dramatic impact, I think, and through the public use of those where that was appropriate and some tactical use of that for those who are the worst offenders, what we got was a very good public narrative around cause and effect there, and we've seen a significant reduction in those types of events because there is a deterrent there, and that fine, that was set by government, but the principle of it and a significant fine level has clearly been a deterrent for those types of events, and we've seen them drop away in numbers massively. They still exist to some extent, but not to the degree that they did. And on a day-to-day basis, I think the reality is the breaches are mixed. They're across a wide range of different things, which is why we need to have an open mind, and our activity needs to reflect that across the country. Okay,
perhaps I can go to Chief Constable Rhodes. I mean, the complaints I'm getting most of is shops who appear to be making no effort to challenge people going in without masks, and it's unlikely that so many are exempt from them. Is a clear thing. And also about people who have been on holiday and should be quarantining, that are going back to work and keeping quiet about the fact that they should be quarantining. Now, I presume that is primarily a migration, an immigration enforcement, but what role does the police have to play in that as well, particularly if somebody has rung up the police to say, I know that my neighbour is working and has just come back from 2 weeks in Spain or whatever.
I mean, I think back to your original point about 3 categories of people, I think we are seeing this polarisation of views around, whether we should be doing the things that people are advised to do. Just last night, we got an alert from the Border Force around someone who wasn't isolating after a travel restriction, 14-day isolation. We deployed to that. We attempted to give that person the opportunity to do the right thing and explain what they'd done and where they'd come from. Because they weren't honest with us, they received a ticket. They are still quite rare occasions, granted, but I think this is not new territories to find ourselves in the middle of one part of the community saying we want more done and another part saying you're doing too much. Back to my original point, what we'd normally do in those circumstances is try to work with the community to problem solve it. Part of which would be an element maybe of enforcement, but it would mainly be around working with that community to problem solve it and win hearts and minds. That, I think, where we are at the moment, and it's not just in Lancashire but everywhere, is that people are, there is a lot of people questioning, they'll do this if they think it's going to make a difference. So, in the early stage of lockdown, everybody was all hands to deck, wasn't it? We're all in this together. And there's obviously been a movement away from that, and the police are in the middle of it. But we will do our best, and I get lots of letters from MPs that are getting letters like you're getting saying what's being done about this. We will attempt to do a proportionate response to those calls and explain to people as best we can that, we're trying to get the message across.
I completely understand that, and I absolutely appreciate, as we all do, what a really difficult job you have now got that does not be made any easier by these apparently conflicting regulations and guidance, and now applied to different parts of the country. And if you are visiting one part of the country from another part of the country in a different tier, then goodness only knows what happens. And now, as for people having sex indoors or outdoors, if they're in an established or not established relationship, don't even go there. But just to come back in how you
don't go there.
No, don't
go there.
How you scale the penalties of this. If and I absolutely buy it that if there's somebody who is clearly having loads of people to their house. And they get reported, then a knock on the door and said, look, we've had reports that you really shouldn't be doing this. But then it becomes a serial case that they are clearly flouting the rules. How do you then scale it up? Do they effectively get a warning, even if it's not a formal improvement notice equivalent or whatever you do? But is it a sort of 2 strikes and you get a ticket? Or how are you dealing with those sorts of serial breaches? Particularly in domestic circumstances?
Yeah, as you say, the vast majority of calls we get when we turn up at somebody's house, for example, and having a barbecue with too many people, if they've got a reasonable explanation and they've actually been caught out, they're unlikely to attract a fine. They're going to get a warning, and the vast majority of those that I see coming through here, people basically say, I'm really sorry, I won't do it again. I tried to get away with it. I shouldn't have done it. That doesn't happen again. But we are seeing people emerge now. I've got numerous people in Lancashire who are on their 6th fixed penalty ticket. I have numerous premises. I have criminals, organised crime groups who are deliberately arranging unlicensed music events in fields so they can sell drugs to people because they can't sell them in nightclubs and bars. So we have got different tiers here, but for the general member of the public, who on occasion might be trying their hand to get away with a few more people in the house for a barbecue than they should, they're probably going to get a lot of discretion on the first time that we're called. Yeah. But if it continues and it persists, they'll get a fine. We had somebody...
Can I just interrupt you for a second? I'm conscious that ACC Wetherill needs to go to another important meeting. If our other witnesses have a few more minutes and can bear with us so that we can complete the final questions, we would be very grateful. Just before you go, ACC Wetherill, can I just quickly ask, is the NPCC continuing to collect information on the ethnicity of people who have been given FPNs? Apologies.
That was my question next.
Sorry.
So yes, we've always collected it. We'll continue to collect it. I think you're probably referring to the analysis work. That needs to be done on a bespoke basis. We haven't refreshed it recently because through the summer we saw very few tickets issued. But now we are starting to see more tickets issued again, particularly in those areas subject to Tier 3 regulations. We are going through another piece of work to refresh that data to see what the picture looks like. And one thing I would stress here is that one of the challenges here is going to be, we will not be comparing like with like, because going forwards, the context for enforcement now looks very, very different to the period that we analysed earlier in the year when the entire country was subject to lockdown. So we will need to be able to differentiate that in some shape or form, so add some extra complexity, but absolutely yes, we will be doing a further piece of work to look at the ethnicity and what that means in terms of the issue of tickets.
And thank you. And then just related to some of our other work, it would also be helpful to know if the NPCC is collecting data on the ethnicity of new recruits to the police force while we're having this uplift in policing, given the importance of increasing diversity in policing. It may be that you can, either you or one of your colleagues could respond to us in writing on that. And then on the guidance and how you're keeping that updated, it would be helpful to have further information, although I suspect some of that earlier confusion about the information was actually mine, thankfully corrected by Andrew Gwynn, who has made clear to all of us that in both Tier 2 and Tier 3 areas, we are not allowed to go and meet our friends at the pub. Thank you to Andrew for that. ACC Weatherall, we're very grateful for your time and thank you this morning. And I'll hand back to Tim Lawton for further questions.
If I might just respond to the question you asked around the recruitment. It's not my area of speciality. However, what I can tell you is there will be a public release of information next week on data, which goes to the heart of some of those questions. So that will be coming out from the programme board next week, I understand.
Thank you. Welcome that. Tim Lawson.
Thank you. Just going back, Chief Constable Rhodes, you just said that you've had people you've issued 6 fixed penalty notices to for barbecues or holding events or whatever. Is that common? And I mean, surely if they're sort of doing things commercially as well, but it's not a sort of big event that's a £10,000 fine, then it's an occupational hazard, isn't it? Getting a £100 fixed penalty notice is they'll take it in their bottom line.
Sorry, no, six fines, did you say? Sorry.
I thought you just said before we got interrupted that you'd had cases of people to whom you'd issued, or your force had issued, 6 fixed penalty notice for presumably 6 subsequent events.
No, sorry. I think it's because I got cut off slightly there. Lancashire's issued approaching 900 tickets overall. And I said the first 600 of those were in the first couple of months of COVID. But we are regularly issuing fines to people who have large gatherings, either in their private dwellings or in public spaces. We've, I think, issued so far £10,000 fines. Those, as I say, have got a senior officer needs to be consulted to authorise those, because it's obviously a significant step to take. But we've looked at those. Those are the ones where, it's either a family have decided to just, be cavalier about it and have 70 people and an Elvis impersonator around for a birthday party, or it's actually the people who are trying to make money out of it, as you say.
Yeah.
There are people. We've gone back to the old rave legislation, actually. We haven't used COVID legislation for the unlicensed music events because we don't need to. We've got legislation under the Criminal Justice Public Order Act about raves, and we've had to just blow the dust off those. And some of us can still remember policing raves in the 90s. So we've
some of the committee were probably out
with those groups. Yeah. That's right.
But just to go back to this sort of serial breach, I mean, what happens after somebody has been issued with a fixed penalty notice for a household breach, might be the barbecue or whatever, and they're doing it again? Do they just get another fixed penalty notice, or how do you scale it up so it becomes more serious? And in the same way as if you'd issued them with the sort of antisocial behaviour various scales before it then becomes a criminal offence? Yeah,
sorry, I did say we had one individual. We have individuals who've had up to 6 persistent breaches, repeat offenders, you're correct.
Right,
that's what I said.
What I was picking up, yeah.
Yeah, so every time you have a fine, the fine increases. After you've done it one time, you will get an enhanced and increased fine. And I think that individual's up to £1,000 now of fines. And, you know, those will be pursued at court. So far, we've had 42% of people pay fines here. And none of the £10,000 fines have so far landed in the court process. But, you know, we will be making sure that people are held to account for it. But we are mapping those people. We know who they are. And some of them are no surprise to us. We've found quite a few people like County Lines drugs teams who, you know, are obviously going to ignore the rules around this if they come into Lancashire from other areas. And they have started to stick out a little bit more because of the reduced travel that we've had. So there've been some opportunity to target those people as well. And they've sometimes, if we've had no other evidence, more serious, as Pam describes, we've given them COVID tickets.
So there's opportunities actually to be able to pick up some more serious conventional criminals because of the attention you're getting with the fines. Well, I'm just interested, what was the 6-time offender who's got 6 tickets? Is that the Elvis impersonator?
No, the Elvis impersonator was at a family party, but the family organiser got the £10,000 for that fine for that one. The individual repeat offenders tend to be people who continue to have large gatherings outside. They're over 18, they tend to be young adults, male, in certain areas of Lancashire who continue to arrange large meetings and gatherings outside, and they're the ones who are attracting the repeat fines on occasion.
But that's going to be harder, isn't it? Because the barbecue is now going to become the indoor things, and that's harder to notice. I mean, obviously neighbours can see smoke coming out of somebody's garden and lots of noise.
That's correct. That's correct, yeah.
So it's not going
we
to
do get a lot of neighbour reporting at the moment. I've seen quite an upturn in that since we went to Tier 3.
Yeah. Thank you.
Thank you. Can I just ask you just a final question just about the implications on policing and justice more widely that you're seeing as a result of COVID? We've had raised with us concerns about other crimes, particularly facing delays in the criminal justice system, delays going to court, therefore ending up being given community sentences or community penalties as an alternative, not because that's the ideal thing for the sentence, but because it's taking too long to get any response through the CPS and the courts processes because of COVID and other delays, and also the pressure on police because of having to deal with the COVID regulations as well. How much of that are you seeing? Start with Pam Kelly.
If I could come in, Roger. Yes, thank you, Chair, and thank you for asking that question because I think it's a really important one. So we are seeing some of our more serious cases actually being delayed. In fairness, in terms of our magistrate court cases, people have worked really hard to speed up the processes in magistrates' court. Obviously, there's been Nightingale courts in some areas of the country. But we are seeing some significant delays in our more serious cases, especially where there is more than one offender. So some of our murder investigations are being pushed for, trials being pushed forward 6 months and beyond. And my concern about this isn't just about the criminal justice process, but is about victims who are at the heart of these trials. And as you know, sometimes it's very difficult for people to report crimes. And for me, justice delayed is sometimes justice denied. And what we don't know yet is how many victims are withdrawing complaints as a result of that delay in justice. But that's not to take away from the great work that has been done to try and speed up some of the cases. But I am concerned about some of our more serious cases. I spoke recently to our head of CPS, Crown Prosecution Service, and he, the head for Wales, and he's really concerned about custody time limits, especially where people are at the moment awaiting trial in custody. And of course, some of those custody time limits would mean that somebody might be released. And of course, that means that the risk is then transferred to our community and ordinarily to policing to actually manage. So that is something that's a real concern for us. And certainly from a policing perspective, we are constantly in dialogue with the courts, with our Crown Prosecution Service, trying to prioritise cases such as domestic abuse, such as those cases of sexual assault against children and rape. But I am concerned that perhaps the speed isn't as fast as it ought to be. And it's fair to say that many chief officers are raising this as an issue that if we don't deal with it quickly, might become an ongoing problem for us. So as we go into another 6 months potentially of COVID increasing, the criminal justice issues are significant for us.
Louisa Rolfe, do you want to follow up on that?
I'd agree with that, Chair.
Sorry, Andy, can I just
discuss this
hang
at
on?
length?
Sorry, Andy. So, could I just bring Louisa in first, and then I'll come back to you. Louisa Rolfe, can I bring you in there?
Thank you, Chair. So, yes, I chair the London Criminal Justice Board, and this is a huge area of focus for us. The Court Service have recently published their recovery plan. I have lots of assurance from partners in London, the Crown Prosecution Service, Majesty's Court Service, MOJ, the Victim and Witness Services and Victims Commissioners, that we are working together. But as Pam has said, we know that there is a connection between delayed justice and attrition. We know that there is an impact on victims. I know that officers, along with all the other things that my colleagues have described, that officers are grappling with at the moment. They're working incredibly hard to support victims whilst we deal with delays. As Pam described, certainly the Magistrates' Court process, there's been significant progress in recent months to ensure that we are working through backlogs. I'm aware that we've increased listings, that we have increased the throughput, and we are seeing some progress in reducing those backlogs. But our biggest concern remains those more complex Crown Court trials, those sort of multi-handed, numerous perpetrators that are incredibly difficult. I have a lot of sympathy with the Court Service in terms of ensuring the COVID security of their premises and how to manage those environments and deal with this appropriately. But it remains a concern for us and a significant focus for us in our Justice Board.
Are you seeing pressure to move to alternative non-court disposals as a result of that, just simply to get some kind of outcome?
I'm not seeing pressure, and certainly we are working really closely with our victim and witness services. So I think there is some appropriate consideration of should we take a fresh look at things, but certainly not at the higher end of risk, and certainly not for cases where, absolutely that wouldn't be the right thing to do in the interests of justice or for victims. So I think there is an appropriate fresh look at, are we looking at how we might use, those really effective measures of restorative justice that we know will reduce offending. And we should always be considering those things, but this might be a reminder of how we do that and how we ensure that we use those appropriately at this time, but certainly no pressure to do something that's inappropriate at this time.
Well, just that having just picked up the alarm around some individual cases which have seemed to be being put through to out-of-court disposals, slightly surprisingly for including violence cases. But sorry, can I come back to Andy Rhodes? Apologies for interrupting you earlier.
So, Norris, the only thing I was going to mention, Louise has covered it about the complex cases, because